Good morning. Is your daily dose of complete health with your local chiropractor, Patrick Hogg. Just wanted to talk about one of the facilities that we have here in the clinic, because I quite often get asked this, especially with people with certain types of injuries. Why would you want to x-ray? Why would I want to x-ray a low back problem if I'm looking at a disc? Because x-rays only show bones. If you're looking for a nerve that's trapped, why would you want to x-ray? Because nerves won't show up on an x-ray. And the funny thing is they're absolutely right. When we look at stuff like x-rays, what we're really able to see is really just the bony tissues. However, when you understand your anatomy, you can start to decipher with the history and the examination findings and the x-ray, we can start to build a clinical profile. Now, this is one of the talents that chiropractors have, is that they can both examine, history take, diagnose, image, and treat the patient for neurological and musculoskeletal conditions. So when we start looking at all of those different steps in that pathway to getting a patient from point A to point B, having a diagnostic x-ray can be really valuable in holding information on how good is someone's bones working, or what kind of condition are they in. Is there degeneration of the joints? Because if we can start to see reductions in the disc height, we can start to determine that that disc has had to bulge somewhere, and along with the history and examination findings, we can start to determine where that may be going, or whether the degeneration is starting to lead to anything like nerve root entrapments. So some of the things that we can actually see on an x-ray is, like I said, we can look at bone health, we can look at the density, we can look at any degeneration, breaks or dislocations of those joints. We can also start to see if soft tissues have started to calcify. So occasionally, when I have patients coming in, they've had low back problems and it's been referring into the groin, it's actually a kidney stone, which is something that I wouldn't manage myself. But when we see the little calcifications of certain tissues, we can then make sure that we refer those people to the right place. You can start to see any damages to the joints. If the joints have started to deteriorate and we're starting to see spurs starting to occur, we can start to see if those things have started to be affected. So as a result, we can start to see if tissues are torn or swollen, because sometimes we get dark shadows as well. We can start to see anything like nerve root entrapments between the bones. We can start to see anything like any alignment changes that that person may have, and then what effect that alignment change may then be having on their bone health as well. So the thing is really to adding to the profile for those patients, this can be an invaluable tool. However, I would always ask the question, would you ever trust the mechanic? Would you ever trust the mechanic that's going to fix your car, who has never once opened the hood of the engine and they've never taken a look underneath? Because let's just say that, for example, and this has happened to me on multiples of occasions, that someone walks in through the door with quite severe low back pain and they've been cleared by the doctor of it just being a muscle spasm, and that person actually has a fracture in their spine and they do not know about it. Now, this has happened to me on a multiple number of occasions. I've had a client who came in who had seen the doctors and had his spine cleared for fractures. And then when I saw him, his examination findings quite clearly suggested that there was something more serious going on. And then when we imaged him, he had a fracture. And I also had a young lad a couple of years ago who came in who had squatted 160 kilos, gone to see his doctor. The doctor basically cleared him, and actually turns out that he'd actually fractured the back part of one of his bones, and as a result had caused a problem there as well. And if we hadn't had those examination findings, what risk would we potentially have posed? So a massive risk mitigation, improvement in quality of care, and actually being able to very accurately say what is going on. So these are some of the huge benefits that you can get from actually understanding your body. So going to a clinic that has an x-ray suite could be the difference between you understanding your problem properly and maybe not understanding your problem completely. And also, this is one of the biggest differences between chiropractors and osteopaths. I quite often get asked that, is that we do have that ability to clinically image. So there are a lot of similarities and differences, but that is one of the biggest differences, that we have that value. Patrick here from Complete Health, your daily dose. We'll speak to you again very, very soon. Take care for now.